Good afternoon. And as you know, since last week, we have been experiencing an increase in positive COVID-19 tests and an uptick in hospitalizations. We're drilling into the numbers and have a number of strategies that we're focused on to tamp down the spread and to get tough on those who are not following the new normal guidelines and the new normal rules. Let me share a graphic with you that shows the spike in positives among 18 to 34-year-olds. Watch the top line. That top gray line that you just saw tracks the 18 to 34-year-old group from March 1st through June 13th. By the end of March, that group had around 500 positive cases in our county. Then the numbers started to go down. By May 18th, the positives were a bit over 200 cases. But after May 18th, the positives have grown almost fivefold to over 1,000 on June 13th. Now, this group is likely the safest as far as getting ill from COVID-19. They're thinking they're invincible because they will likely be asymptomatic. In fact, they're at high risk if they are overweight or they have certain medical conditions like diabetes or lung problems. At Jackson, over the past week, excuse me, they have seen about 1/3 of the patients admitted were 18 to 34-year-olds. About half of those younger patients had a high body mass index, which indicates that they're overweight. Because those who have no symptoms are still potentially spreading the virus to anyone they come in contact with, including parents and grandparents. And remember, our goal all along has been to protect the most vulnerable people over the age of 60 who can get severely ill from the virus. We don't want hospitals to be overrun, and that's why we've been so careful about protecting the elderly and continuing our safer at home order. We also want to protect our healthcare workers who are the heroes of combating the virus. They have been at it for more than 3 months, and they have made huge sacrifices, often staying away from their own families to continue to save patients. So today, I'm asking parents and grandparents to be very careful and not get close to your kids or grandkids. Obviously, there's no county order that will make people do this. It's just common sense, and it's really a matter of life and death. Now, there's another trend that we're also addressing, and that's hotspots, where the virus is spreading faster than in other areas of the county. We're mostly in the Brownsville area, Little Havana, and Allapattah neighborhoods in the city of Miami, and also in South Dade around Cutler Bay and the Homestead area. We're forming a SURGE ambassador team, which stands for Strategic Urban Response to Guideline Enforcement. The SURGE team will be going into neighborhoods and speaking to residents and businesses about the importance of wearing masks inside businesses and also outside when it's not possible to practice social distancing of at least 6 feet from others. I've directed Deputy Mayor Jennifer Moon to put together a team of 100 people who will be knocking on doors to provide information to residents. We're also preparing kits to hand out with masks and hand sanitizers. I've assigned Deputy Mayor Kemp to continue to work with the state and other partners to open up more testing sites and have more mobile testing. I met with the State Department of Health and our medical experts yesterday to strategize about hard-hit areas, and many of the doctors are with me here today. We know that in the Homestead area, there are farm workers who are testing positive, and some of them live in very small homes with many people packed in. It's difficult for them to self-isolate in such close quarters, so we're going to try to help them and others throughout our county to stop the spread. Florida Department of Health will be alerting the county to those residents who are in dire situations but not so sick that they need to stay in the hospital. For those who need to isolate, the county will be providing a limited number of hotel rooms until they test negative for the virus. The eligibility criteria will be handled by the health department, and everything will remain confidential to protect people's privacy. The county will supply the rooms for those who are eligible, but we will have no other details. Now, before wrapping up, I want to talk a little bit about the uptick in hospitalizations. We still have plenty of acute care and ICU beds, but there are some hospitals that have transferred their patients to other hospitals in their healthcare systems. Baptist Hospital, for instance, transferred some of its COVID patients from its Homestead facility earlier this week to other Baptist hospitals. And that's not unusual for all of our hospitals in the county. Remember, many other medical procedures are not being done at all hospitals, so you always want a good balance of available beds. The capacity overall in Miami-Dade County is very good and pretty stable. The number of COVID patients in our hospital is still considerably less than what we saw during the height of the pandemic. We also have a temporary hospital built by the Army Corps of Engineers at the Miami Beach Convention Center for any overflow. And the old Pan American Hospital will also be available for nursing home patients who need to isolate but are not severely ill. Now, I want to ask a favor of those who have recovered from COVID-19. Please donate your plasma. It's one of the potential life-saving interventions that hospitals use early on with moderate to severely ill patients. We're finding a lot of success in this type of intervention, so please help. To donate, go online to oneblood.org and you can sign up. The next 2 weeks are very important because we want to make sure we keep tamping down the COVID curve. So you'll be seeing a lot more messaging on donated billboards throughout the county, reminding people to wear masks and practice social distancing and to stay home if they're sick. Miami-Dade County Police will continue to be out in force to make sure the rules are followed. Businesses that aren't following the rules will get shut down until they can show that they have met the new normal guidelines. Enforcement is key, and Miami-Dade Police and the municipal police departments are amping up. Our goal is to be able to continue to open our economy, but only under the right conditions. So we're on pause right now until we see improvement. And I want to once again encourage our seniors to stay safer at home. Now I'll take your questions in English, and our medical experts and two of my deputy mayors, Maurice Kemp, who is coordinating testing sites, Jennifer Moon, who's overseeing the new normal guidelines, are also available to answer your questions. And then I'll say a few words in Spanish and answer those questions. Patty, who do we have?
Thank you, sir. We'll start off today with CBS 4. Mike Cunho is the reporter. Mike? Do we have Mike? Okay. Let me see if Christina Vasquez from Local 10 is on. I know she was getting set up for a live shot.
Hi. You have me for like a minute 30. Hi,
Okay.
Mayor. Real quick question for you. If you can go a little bit into a little more detail about your surge teams, and we're also curious to see if you've had any discussions with Miami International Airport. Right now, they're still screening from the tri-state area. We were curious your thoughts if they should also now be screening from other states that are seeing surges like ours, to include Texas, Arizona.
The answer to the question is that is a responsibility and also the purview of the Florida Department of Health and also the federal government. And so folks coming from the tri-state area are screened when they get to Miami International Airport. We're also advised that they need to self-quarantine. And so it's a discussion I need to have with the self-quarantine for 14 days. That's the governor's order. That's still in effect. So I need to talk to the governor and see if he has any other ways that maybe he can do the same thing for other states that are experiencing a surge. And then I'll get back to you about his response. But that is a Florida Department of Health issue, or the Florida Department of Health purview, and along with the federal government.
Is there any way you can expand a little bit more on those surge teams in the hotspot areas?
Sure. The surge teams are going to be folks that are going to go into those areas to look at businesses and also into knock on doors and give information about, hey, there is a spike of COVID-19 in your area. These are the things you need to do to protect yourself. And we'll be handing out kits to in those areas for people that need them, masks. Hopefully we can have hand sanitizers, other things to keep them safe. And the message also will be for those elderly to, if you are living with younger folks, even though they're part of your household, it'd be a good idea to kind of stay away from them for a while, especially if those younger folks are actually doing something, going to work, etc. We have seen a surge in younger people, as you saw in the graph. That's a huge spike in younger folks. And we also need to drive home the message to our younger residents that, hey, it's your responsibility to keep safe. Yeah, you may want to go to a party, you may want to hang out with your friends, etc. But as you've seen, a number of you are positive, and so you have to assume that everybody is positive, especially if you live with your parents or you're close to your parents or your grandparents. In order to keep them safe, you have to keep yourself safe. And so that's also a message that we're going to be putting out with those surge teams. And so we see the surges or the spikes actually in 3 different zip codes. I think it's 33142, 33125, and 33030 down in South Dade. And so we'll make concerted effort in those particular hotspots to get the word out.
Thank you.
You're welcome.
Thank you. Let's move on now to the Miami Herald. Doug Hanks.
Thanks so much. So, Mayor, the surge teams will not be interacting with people who contracted COVID, but will just be in the neighborhood, kind of trying to spread the word.
Yes, because there is an unusual number, a high number of positives coming from those neighborhoods, and so we'll try to also get the information from the Department of Health, kind of zero in where in that zip code are we really having the problems. And so the zip codes are pretty big areas, and so right now it's divided into zip codes, but we can also get information that kind of zeroes in exactly where that is and start working in those areas to educate the people in those areas that, hey, you have a high incidence of COVID-19 in your area, you need to watch out. Tell the elderly there, hey, you need to be extra careful because there's a lot of COVID-19, a high number of COVID-19 patients in this area. And a lot of them happen to be young. And a lot of those are not going to have any symptoms, but they're going to be spreading the virus, so you need to be careful too. So not only is it the responsibility of the young folks that are we're seeing this rise in the COVID-19 cases, but it's also the responsibility of folks like me. Like, I'm 66 years old. I got to take care of myself. I got to be extra careful that whenever I'm around any family members, that I keep my distance, wear my mask, and practice social distancing. Don't touch, my kids, my grandchildren. The same thing, and any family member that doesn't live with you, or even if they do live with you, but they go outside, you need to start distancing yourself from them for a while until we start to tamp down the infection rate here in Miami-Dade.
Can I just follow up regarding the hot spots? Are you getting any insight from the contact tracing reports from the state as to where the problems are and sort of where they're coming from?
We obviously have the information that we know that the positives are in a certain area. We also are in contact with the state, and the Department of Health is actually zooming in on certain what they consider to be problem areas. And so they're actually doing a lot of testing through their contact tracing, they know, hey, there's a hotspot there. Let's go over there and start testing. I think that's one of the reasons why you're seeing this spike in the positive rate, which is a good thing because they're identifying those places and then going in and identifying those that have the disease. But if that also basically shines a light on these certain areas, we need to go behind them and we need to start educating the people around that area that there is a high incidence of COVID-19 here. These are the things you have to do. Again, re-educate them on the things you have to do. And if you don't have some of the supplies that you need, we're going to start issuing some of those supplies, the hand sanitizers, et cetera, masks, to keep you as safe as possible.
Thank you.
You're welcome.
Thank you. Sir, I have a question from someone who's not on the line but is watching, Catherine Kalergis, the deputy web editor with The Real Deal, Real Estate News. She wants to know if someone can share more details on the county providing hotel rooms for people who need to self-isolate.
Sure, I can have Jennifer Moon answer that question. And so we're going to be working with the Department of Health. I think it was in my comments. And the hospitals will be referring those folks to the Department of Health, who will then have a screening process. And then those folks that are eligible will be referred to Miami-Dade County, who will then provide a limited number of hotel rooms so that they don't go back into crowded spaces being positive or possible high probability of being positive. So they don't go back into a crowded space and basically give it to the folks they're living with. So Jennifer, any other information on that?
We're going to be working with the hospitals and the Florida Department of Health so we can identify people who have no other way of being able to isolate. We want to be able to really tamp down the spread of the disease, and especially people who have been tested, have symptoms, but we don't know whether or not they're positive yet. They don't have to be in the hospital, but they really should be self-isolating, and that's the population that we want to make sure can be safe and protect their families.
Thank you so much. Now we have a question from Philippe Enol-Bouteau with the Haitian Times. Philippe?
Yes, can you hear me?
We can hear you, yes. Philippe, your audio is not good. We can't understand what you're saying. At least I can on my end. Mayor, do you hear well? No. Okay. I'll see if he can send me his question, and I'll ask it for him. Okay, I know we also had another Local 10 reporter here, Leanne Morejon. Are you there?
I'm here. Good afternoon. I had a couple questions. I wanted to follow up about the surge teams and find out who exactly is making up these surge teams. Are these health department employees? Are these Parks employees? Are they going to be new hires? Who's going to be comprising this team of 100 people to make up the surge team?
Jen, can you answer that question?
Sure. We already have in place a Goodwill Ambassadors program with the county that we'll be accessing. These are county employees who want to go the extra mile and do things for their community. So we'll be accessing the Goodwill Ambassador program, but supplementing those folks with the same folks that have been helping out at the parks and the beaches. They are people that we can bring on that may have been event staff or other, had other positions that are not really available right now. They can come help us. They can work with the community and make sure that we get the information out to everybody that needs it.
Okay. I also had another question, if I may. This is regarding Miami International Airport. I know that at some point passengers were being screened specifically from the tri-state area, so New York and the surrounding area. Now that cases have surged in other spots and that area has, they're basically quarantining Floridians, Arizona, residents of Arizona, Texas, etc. Basically the states where we're seeing more cases now. Is there any plan to change who is being screened at Miami International Airport? And I'm sorry, I'm just understanding that you may have addressed this already.
Yes, we did, and that's the purview of the Florida Department of Health and also the federal government at the airports. They screen everybody coming from the tri-state area. I would anticipate that they will expand that if they think it's necessary. Also, I will talk to the governor, and does he feel it's necessary to also have those folks coming from those states that are experiencing a surge do a self-isolation for 14 days. That's the order right now for anybody coming from the tri-state area. Not only are they screened at Miami International Airport, the order from the governor is that they have to self-isolate for 14 days once they get here.
My apologies for being redundant there. My last question, if I may, is are you considering, since we're trying to tamp down on this, the increases that we're seeing, I mean, are you planning or even considering fines for people who aren't obeying mask rules in public places, such as in parks? If someone's walking their dog and they're not wearing their mask, I mean, are we considering fining people? Is that something that's on the table for you? And if so, who's going to be responsible for,
we're actually looking at, right now there are criminal offenses that if you, technically, if you're within 6 feet of somebody and you're not wearing a mask, you're actually in violation of an order. And it's a second-degree misdemeanor. You can be fined up to $500 and then spend 180 days in jail, technically, okay? I'm not saying we're doing that, but you can technically do that. We're looking at a way to make this actually a civil citation and a criminal citation, so that you can be fined civilly by a number of inspectors from our, like building inspectors and fire inspectors that are going to help us with these, enforcing these rules. At a much lower level. But yeah, you can technically be fined for violating one of our orders, and the violation could be as high as a second-degree misdemeanor. So yes, is it on the table? Yes, it's on the table.